We got to change your name, Dr. Manthis. Hi, good morning, everybody. Welcome to the Urban Chambers Healthcare Roundtable, where we host this Healthcare Roundtable every fourth Tuesday at 11 a.m. You'll notice that today we did it at a different time. It's Wednesday, 11 a.m., but meet us back next month at 11 a.m. with our hosts, Janice Wiggins and Lauren Parker. Today, I am one of your co-hosts of this roundtable, Denisha Mingo. I am the CEO of Mingo Health Solutions, where we provide therapy and counseling services, as well as ABA services for kiddos who are diagnosed with autism. I'm also the founder of Solutions of Change, a nonprofit that provides free counseling and therapy for those who are uninsured, underinsured, and undocumented. I'll share that information in the chat for you a little bit later in the show. I'd like to welcome my other co-host, Miss Elisa Howard.
I love the way that Denisha just represents everybody. She's so energetic. I feel like she's a game show host. Elisa, thank you, Denisha. Thank you.
One day I'll be on national TV. Okay.
Yes, you will. Yes, you will. Hi, everyone. My name is Elisa Howard. I hope to have as much excitement about this as Denisha does in my voice. I am Elisa Howard. I'm the owner of Minority Health Consultants. I'm a public health educator, consultant, and a community health worker instructor, and a community health worker myself. I help stakeholders in the healthcare and public health and just human services arena get contact and health outreach and health education, everything to reach the minority community pretty much. And so I kind of help those stakeholders get into the minority community so that they can provide what they need to provide to uplift the community. So I am happy to be here today. We have our guests on today, and we're happy to be here with Reagan Comas from R&R Partners, along with her doctors that she's brought along. And I'm going to let Reagan introduce those doctors. But today we're going to talk about medical liability reform. That is the topic for today. So Reagan, if you can introduce yourself and the doctors you brought along with you.
Absolutely. And thank you, before I get started, for the opportunity to present. We appreciate the time and your attention. And so let me start there and just thank you both. I'll start with Dr. Rudy Manthe. Dr. Rudy Manthe is a retired ophthalmologist who actually started the first and only ophthalmology residency program here in Nevada. But he's also been at the forefront of the fight for medical liability reform for over 20 years as chair of Your Nevada Doctors, which I'll share more about our organization here in a few. And so that's Dr. Manthe. And then I'd also like to introduce Dr. Coates. Dr. Coates has spent 12 years as a general internist, but he's also served as a chief medical officer and the president of operations for Nevada healthcare integrated system. And so he has a wealth of knowledge to share with us, but he also is serving as an adjunct faculty at the new Kirk Kerkorian Medical School down in Las Vegas in reviewing medical student applications. And so grateful to have them with me today.
Yes, we are so grateful to have you. And for all of you out there, you know that we host this healthcare roundtable to discuss issues regarding mental health, public health, and even policy that influences medical care and healthcare in the state of Nevada and beyond. And so it's so important that we have conversations like this. And we're really excited about our guests. I mean, they have extensive tenure and accolades and experience, as well as expertise in their subjects. And so we have bios that we could share with you all, but we want to allow them in the conversation today to show you who they are. And so Reagan, before, I know that you have a presentation that you want to share. And for those of you who are joining us as participants, you'll notice today is a little bit different because it is the legislative session right now. And it's important that we discuss these issues as we are deciding what we're going to vote on. And so we are going to allow Reagan and Dr. Coates and Dr. Manthis to discuss some things through a presentation, and then thereafter we will welcome questions like always. If you have questions during their presentation, go ahead and pop them in the chat or on the webinar. Hey, y'all out there in Facebook, pop your questions there too, and Kawana with the Urban Chamber will get those to us so we can make sure that you are included and the things of interest to you are answered. So Reagan, before you get started with your presentation, can you share why this conversation is particularly important to you and or the doctors who are here?
Yeah, absolutely. For us, the greatest issue that we are facing from our perspective is access to healthcare, access to healthcare that is affordable. And we are seeing our organization has fought to ensure that patients and Nevadans have access. And while we can agree that there are some areas that continue to need more work, there is legislation that we know will be coming before the legislative body in 2023 that could negatively impact our ability to access care. It could have an impact on facilities closing and our ability to, first of all, retain as well as recruit physicians here in this state. And so we are excited for the opportunity to present this to you.
Well, thank you. We're excited for you. Before you as well, we want to hear from Dr. Coates and Dr. Manti. Say hello to us.
This is Dr. Manti. It's very nice for you to offer us the opportunity to talk about something that we're very passionate about.
Wonderful.
Yeah, again, thanks for having us on. I really use the passion word, and you're going to see that throughout this presentation as those of us who've been in practice and have been managing medical groups and working in the community with all sorts of stakeholders trying to, and Reagan will go over some of the statistics about access and the number of physicians in the state now. And anybody who touches the health system knows that the access issue is not fake. It's not fake news. It's serious. And anything that happens to lessen that will be bad for every square mile of the state and every single patient trying to access healthcare. So this is an important component of that overview.
Thank you. And
Well, we are
appreciate
so
that.
grateful.
Yes, and we're grateful for you all to be here and share your knowledge with us because we need to learn, and we hope to spread this out to everyone so that they can learn as well. All right, Reagan, did you want to get started with your presentation?
Yes, look, yes. And so would you like me to pull up?
We can do it on our end, Kawana.
Perfect.
Kawana, do you have it on our end, or do you want Reagan to pull it up?
Reagan can pull it up.
Okay.
Okay, I will share my screen. Share. And I'm beginning here.
Bingo.
Perfect. Well, thank you again, and we appreciate your time. I can probably bypass what I'd written down for this slide, but again, Reagan Comas with R&R Partners, and I have the opportunity to have Dr. Coates and Dr. Manti with me to share this topic with you. So I'll move on to our next slide. So who is Your Nevada Doctors? We are a patient-first advocacy group that is focused solely on protecting access, affordability, and availability of healthcare for all Nevadans. Our broad coalition is comprised of physicians and healthcare providers, hospitals, both urban and rural, chambers of commerce, and a growing list of organizations that recognize the necessity to continue to advance and grow healthcare options in Nevada. As we will discuss on the next slide, Nevada is at a breaking point when it comes to access to healthcare. While I doubt any of this information will be new to any of you, Nevada is 45th in active physicians, 48th in primary care physicians, and 49th in general surgeons. Nevada is below the national average in 33 of 39 specialty areas, including general surgery, pediatrics, and psychiatry. While this data is important, I believe we will all know this to be true if you've tried to find care for yourself or a loved one. And this is an issue that we find in the entirety of the state. It is both urban and rural, both north and south. We need more healthcare providers of all types, and Nevada is making strides to achieve this. With the completion of the UNLV Krikorian School of Medicine, we now have medical schools in both the north and south, which is wonderful. That said, if Nevada is not a feasible location to practice, we will be educating physicians, but unable to retain them. We'll discuss the retention further in today's presentation, but from here, for the next slide, I believe it'll be presented by Dr. Manti.
Thank you. So just a little step back in time and hopefully something that we can avoid. But if you all recall back in 2002, we had a situation where the UMC Trauma Center closed down. And the reason for that is because prior to that, the the malpractice lawsuits were egregious and basically and also threatening physicians' personal assets to the point in time that physicians as well as facilities were concerned about practicing, and the med mal companies are actually leaving Nevada. So what happened is that the governor, after the UMC Trauma Center closed down, called a emergency session. And what they did was they put together some changes that were necessary to open the trauma center, but not significant changes in order to affect the basic problem. And the basic problem being that 80% of claims have no merit, and large awards which were occurring, which were in the multi-million dollars, basically caused a kind of a frenzy with the trial attorneys, and the point in time that prevented the physicians from being able to practice, and as I said before, caused the liability companies to leave Nevada. So that's what happened way back then. We qualified an initiative in order to deal with that, and that's the current law right now, and I'll go into that a little bit later.
Thank you, Dr. Manthe. So as Dr. Manthe said, given the challenges the healthcare community and more importantly, patients were facing, passionate individuals such as Dr. Manthe and some others began advocating for reforms. And as Dr. Manthe mentioned, there was a special session called by Governor Gwynn, as well as question 3 on the 2004 ballot, where this organization fought to ensure patients have access to their doctors and the care they need by putting reasonable limits on medical malpractice suits to limit the frivolous lawsuits and exorbitant costs that are associated. This has enabled physicians to maintain medical malpractice insurance with rates that allow them to continue to provide care. We also fought to ensure that plaintiffs in these cases, if there has been an incident, receive the compensation rather than attorneys taking large portions of those awards.
So Dr. Coates, I'll work on this slide here for you guys with a minute. I want to make a personal statement. Some of the finest people in my top 20 that I've ever worked with and around in business or personally are attorneys. Attorneys are absolutely essential to our company. So when we talk about issues with the trial lawyers and some of the associations and work that are happening, we're not disparaging the legal profession. They're just parts of it. Just people love their doctors, but oftentimes don't like the healthcare system. It's the same kind of conversation. So part of the work Rudy mentioned, the governor calling a special session, then having an initiative on the ballot to put specific regulations in place to keep the liability cases from causing tremendous loss of physicians and hospitals. Then after the ballot measure passed, which was quite an effort, legislature had to come back together and take that and put it into regulation. And several of the things that you're going to see here that are defined are part of those regulations, because it's maybe common knowledge as to what these things are, but putting them in regulation was absolutely essential. So professional negligence, economic damages, non-economic damages, and then attorney's fees all were addressed in the regulations once they got codified and finished and put in place. Professional negligence is pretty, we could pick this one off a list of things about a negligence in care. And bad things happen even with good people doing good things that ought to work 95% of the time. So professional negligence does make it clear that the failure somehow of a provider of healthcare, be it a physician or a hospital system, if they've done everything sort of what they should be doing, there's no malfeasance. It's just something didn't work well, didn't come out well in a complicated system, and that's professional negligence. The next definition is economic damages, and there's no limit to how much economic damage one can do in a trial or award the plaintiff when there's a loss or a complication. And these are the treatment, care, custody. You can calculate loss of earnings, and one would call that pecuniary, where you can actually, as a specific word used to talk about financial things, where you can actually calculate those things. Plus, future medical costs can be put in a damage award if there's a finding and that the plaintiff can receive. The other is non-economic damages. And these are things that are not calculable. They can be subjectively reviewed, estimated future future concern, but these things are harder to calculate. And we're part of the issue with awards that were happening, not broken down like this. So this is in language now. And there is a limitation that got put in from the initiative and the regulations of $350,000 for things that you can't really calculate, but you know there is some suffering and some problems that need to happen. And the last comment is the attorney's fees. And prior to the initiative, there wasn't a statute around this particular kind of attorney's fees of medical malpractice, professional liability. And so Nevada chose to use some of the wording from the California statutes, so that going forward after the legislation got put into play, the findings are scaled, so that the more money, either in economic or non-economic damages that happen, the higher the award, the less the attorney fees when it goes up higher. Because when you get a case like that needs that, attorneys need to be paid and rewarded for the work that they've done, but not to take 65% of settlements or things like that. So there are specific tiers of if the award is this high, you can take this percent of it, and if it's this high, there's a little less percent of it to take. So these things are all codified and put in play. And these things, over the 20 years since this passed, and I had just come to Nevada a couple of years before that, it was watching some sort of a bad movie with docs leaving. My wife, who's now a retired OBGYN doc, her professional liability insurance and her solo practice, and went up 3 times. It went up tripled in one period over another, to the point that you could hardly practice effectively without taking a cut in everything that you did with your staff and everyone. So these things have sort of stabilized things for the last 20 years. And the work that Rudy, who led the charge with what used to be called Keep Our Doctors in Nevada, CODN, and that was a 5-year journey for many of the physicians, and led by Rudy and others, to get that all taken care of and tucked in. So it's been a different world in the last 20 or so years after this has been in play. Reagan, I'll turn it back to you.
Great. I'm going to get it to Dr. Manthey.
Rudy?
Okay, so risk to patients. I think it's pretty simple, and that risk to patients is access. Realizing that what statutes were placed and passed back in 2002 was question 3, which we passed with the 60-40 when we went to the voters, because we couldn't get anything done legislatively, and has stabilized this system. But even with that, we have lost over 1,800 physicians since 2020. So having an access problem in the first place, and having physicians leave and retire and not being able to replace them, even though we're doing a job as far as training physicians, is a problem. And doctors are very uncomfortable in a legal system, and very, very much do not want to have issues as far as with lawsuits. And if that we are considered a litigious state, it will be very difficult to recruit doctors. Part of the system is also as a failure, is not just the doctors and the legal system, is the judges. The leading defense attorney basically said of the 32 current judges, 25% of them have no civil trial experience, and none of them have any background in medical liability. And with that, the current situation is right now is that the attorneys are basically bypassing the statutes that we put in place, and essentially going after something called fiduciary duty or breach of contract. And with that, there are no protections as far as any limits on awards. When that is happening now, which it has, we've recently in the last 2 years had 2 awards, almost $40 million. So if you take a look at the system's out of control again. And the reason why is many different issues, and that's creating a problem with and here again, that's causing more of a risk to patients, because you're not going to be able to have the health providers that'll be here. And it affects mainly as far as crucial areas, as far as specialty care, pediatric care, rural care, are all being threatened by the system that is now broken again, that needs to be fixed. And unfortunately, we haven't had much luck as far as legislatively. We've had to go the initial way to be able to do that. So that's kind of where we are right now. And so we're really reaching out to everyone to be able to work as a coalition to institute not only protections, but also new reforms to make things better.
Thank you, Dr. Manthey. And then I'll just, before I move on to the next slide, just highlight some of the changes that were made in New Mexico and California. We were seeing those limits of $350,000 in Nevada, which has helped stabilize our rates as best they can, increase to $1 million and $750,000 in California and New Mexico. And if we were to see a rate increase like that happen here in Nevada, our physicians would not be able to absorb that cost and afford those rates to be able to carry the liability insurance that is required by state and absolutely necessary. So,
May I ask a question here?
yes, please.
So when we talk about frivolous lawsuits, what types of lawsuits are considered frivolous? And then I guess as a follow-up, I'm definitely hearing about, the trial judges being a big part of the issue. Why not seek to push to maybe require them to have some experience or training or education versus, changing a law that could impact consumers' protection?
This is Dr. Mann. Those are excellent questions. And what I would say is that to create a system and we tried to do that before, create a mandate that the judges that would hear these cases are ones that would have expertise in doing that. But that we are unable to get that to go through the system. But that's one of the things that, as far as changes to consider, would be a way of moving forward with that.
And Danisha, if I could just add to that, there was in the early 2000s requirements for various trainings for judges, but that language was actually removed from statute. And I believe 2012, don't cite me for sure, but I believe it was in 2012, 2013, that language was removed statutorily. So now those trainings are no longer requirements. And so while we don't disagree with you that this should be mandatory training for judges, that requirement was removed.
Thank you both.
Yes. So as we move into 2023, while Nevada continues to recover from the pandemic, as a state, we learned how our limited healthcare resources are strained, the necessity for healthcare providers, and how a lack of providers limits care to patients. We have seen this both in the medical and behavioral health spheres. We need to grow our healthcare community, not place additional barriers. That said, we know the trial attorneys are actively working and will be bringing legislation to the 2023 legislative session that will place barriers and make it more difficult to retain and recruit the healthcare workforce we so desperately need. But Your Nevada Doctors has also been active. We have been educating legislators, candidates, community groups, and business organizations on the importance of maintaining the protections currently in statute. So we do have the workforce available to provide the care for all Nevadans. And then finally, I promised we would not have death by PowerPoint, our final slide, and thank you for your patience and allowing us to do this. And I know we've shared a lot of information with you very, very quickly this morning, and thank you for your attention. We do see this as an imminent threat to patients, and should the trial attorneys be successful, we will see facility closures as we did in 2002. Physicians will be unable to provide care, and in the end, it'll be Nevadans who pay the price. We're happy to answer questions that you may have, but as an organization, as we're speaking to groups just like yours, we are asking for your help to protect patients and join us in pushing back against the attempts from the trial attorneys to make unnecessary changes that will harm Nevadans. And with that, I will end my share screening and allow you all to have the floor.
That was great. Oh, go ahead.
Go ahead, Lisa.
That was great. I don't know if you all saw my face, but my facial expressions, I'm not really good at keeping them solid, but I'm like, what? I used to want to be an attorney, and I went to paralegal school and worked with attorneys for a few years and in different areas of law. And I was just it kind of took me back to that day, to those days. And it made me realize I did the right thing by coming into public health. I think this is horrible. I think patients need to be protected. I think you all need to be protected. And at the same time, that's the reason why I got out of law. It's a very litigious field, and we're teaching people how to be litigious, right? How to sue for everything, right? You hear people say, "Oh, I'm going to sue." It's just for everything. It's become really ridiculous, and it unfortunately affects our healthcare. It's getting to this point where it's affecting our healthcare. I'm born and raised here in Las Vegas, and so I see what you all are talking about in this presentation and what you all are saying as far as our healthcare being affected and facilities closing down. Our only mental health facility closed down years ago, and we know that, and we know we have a huge mental health crisis happening right now. So I definitely see how you're pushing this policy is very important. Of course, everyone has, two sides to every story. I'm sure somebody on the other side is going to say, no, I didn't like that presentation or whatever. But if you look at it from a humanistic point of view, if we're here in Nevada and we need to go to the doctor, obviously, the eye doctor, obviously I wear glasses, the cardiologist, every type of doctor, and we don't have those people here, it's going to make healthcare access really hard. Working in HIV, I've seen where we've only have 30 infectious disease doctors and over millions of HIV positive people living in the country in general. And so having only so many in every state really causes health access issues for people living with certain infectious diseases. So I just wanted to say that I heard you all. I hear the importance of this, and I'm still kind of like wrapping my mind around some questions, but Denisha had something she wanted to add.
Yeah. I mean, I appreciate it. I think it opens for a wonderful dialogue. And of course, like, we are here to have a conversation and a dialogue. And so I am definitely in advocacy, being a healthcare professional myself. I'm in school right now to become a clinical psychologist. We know the disparities. I will play a little bit of devil's advocate because I do want to ask the questions that maybe people are not going to ask. And we are here with the Urban Chamber of Commerce. And so we're talking primarily to minority communities. So if we can just first go back to that question that I asked about, what are some of these frivolous lawsuits? Like, what's categorized as frivolous? Because of course, like, we know that people are like, this happened wrong, and we're all doing our work in good faith, and then they want to capitalize off something that shouldn't be. So can we maybe get a few of examples?
Well, this is Dr. Meehan again. So one of the things that we have, because that question has been brought up, and the reality of all the malpractice claims that have been brought, 80% are found to have no merit.
Okay.
So statistically, and the reality in the real world is this: is if you really have real malpractice, because it's a very difficult thing, a bad outcome is considered malpractice. But the thing of it is if you have really malpractice, doctors settle, hospitals settle. They realize been wrong, the person's been harmed, and essentially they resolve it. It's the cases that actually go to trial are ones that typically that are questionable, but very few cases actually go to trial and actually the awards. And I think less than like 5% actually get that far along, and then actually where there's a verdict for the plaintiff. So the real problem is essentially costs associated with all this and the trauma that anxiety go along with this. Just a tax our current system to point in time where it's creating, an atmosphere of litigious society. Just Nevada just is. I mean, the reality of it is, we all know as soon as the election's over and all these commercials go away, we'll be back to the fact that we're going to be bombarded with attorney commercials. So it's just the environment that we live in. We're just trying to do the right thing to basically to make it a society that we provide access and here again, frivolous lawsuits. But the reality of it is that the initiative that we passed has a lot of things that make the individual whole, and that's why we did it. The whole thing is if somebody's really been harmed, then they really need to have the benefit, and you need to have payments, and you need to have collateral sources, and you have all these things in place to go along with it, and basically is to make the individual whole. And so it's a package.
Denisha, Dr. Coates, let me add one minute on top of Rudy's. The frivolous word sounds frivolous because it's intentional. The 20 years I practiced medicine in California, and kind of watch things from the ground level, from a private practice situation. I got sued 3 times. 2 of them were frivolous by patients who didn't understand what was going on. They wouldn't listen. The family wouldn't listen, and then they got dismissed. They weren't able to get into a point where it was down to pretrial, and they quit because they realized they weren't going to win it because too much had been frivolous in the way they brought them together. As Rudy said, the ones that have merit, just bad outcomes, those get settled. They happen all the time. California has extremely detailed data on cases that have been filed. Nevada doesn't have quite as deep and as specific knowledge of that, where you can't just go find it and check it somewhere. But that's true. 85 to 90% of cases don't ever result in anything with merit. And defending the other 85 that didn't get there is almost as expensive as going to trial. So that all that money that goes into that, defending physicians, hospitals, PAs, nurse practitioners, the whole team of healthcare, and that's the way healthcare is practiced now, is just disruptive and financially a disaster if there aren't some sort of limitations on how those things work. Thanks for asking.
Yeah, no, I can definitely empathize. I myself have had to settle something of which I was not guilty, for those reasons. So if I'm understanding correctly, is part of the trial attorney's reasoning for wanting to push this legislation, is it to recoup lost money for economy, or like, what is your all understanding of their purpose? And I guess leading up to that, I know I asked a couple loaded questions, but I want to be very candid here. When we look at the disparities, right, amongst minorities and particularly African Americans and the issues that they face in healthcare, the maternal health rate, hypertension, like all of these things and things that cause them health issues. I mean, just within the last couple of months, I know somebody who was released from a hospital who was caught in the middle of a stroke before having any debilitations to their body, released, not into the care, not properly educated, and then went home and the next night had a stroke and now doesn't have use of their hand. I know somebody else whose child was diagnosed with type 1 diabetes and was taking insulin for a year and now went back and the doctor's nowhere, not at the clinic, and the new doctor saying, oh, they actually have type 2 diabetes. And so now they've been shooting themselves with this insulin. And a lot of these people don't have the knowledge or resources to even bring about suits, to even know where to go to say, hey, I have been treated, improperly, right, by my healthcare providers. And while I think that no healthcare provider, it's my choice to believe that no healthcare provider is, being biased, intentionally, we can acknowledge the disparities in healthcare. And because due to education and the cost of becoming a doctor, we're not seeing those numbers level out as far as having diverse providers, which leaves minorities at greater risk of having these issues. So I guess I'm just curious of what the numbers are in regard to who's bringing these suits, and I guess what the trial attorney's goal is with doing that. I want to make it very clear. I believe we need to protect our providers. We need doctors in this state, but we do know that those disparities exist. And I wonder what putting this cap might do to those people who really need it. I myself also was en route to law and worked at a law firm. And I remember a case where a guy was set on fire in a coma in the hospital, and the doctors were all fighting over who was going to pay over this man who was set on fire. And their argument was, well, he didn't really suffer any pain because he was in a coma at the time. And I know those are just few cases in regard to the many that you guys are experiencing, this 80%, but I'm curious about that protection for these people who are disadvantaged and experience these things.
That doesn't sound like anything in the 80% range. Maybe on the other side of that percentage. Let me have one piece of color, and I guess that word could be used more than one way. The joy that I have of participating in the applications for folks coming into med school at Kerkorian, and I think most of the med schools around the country are just so much different than it used to be. I'm a community faculty, so I don't talk to them directly, but they have to answer 8 questions 6 to 7 minutes each that are standard ones that everybody has to answer. And watching those videos and the framework that we have set up. Now, these things are all, it's almost like proprietary. Every med school does a little bit differently, and you can't see in the black box completely. But part of the prioritization that we're to give is for people's diversity, inclusiveness, and background, and community volunteering, and engagement with their fellow citizens. And watching these recorded interviews with these folks and looking at who they are and where they come from, it's a different world. It's exactly the way things should be. And you're looking at two, Rudy and Bard, Caucasian males from med schools, where, out of my 165 people in University of Oklahoma, there were 10 women and 12 people of color, separate from just the gender. So it's half and half women now. The other things are happening, and you look at the graph that we've got from UNR that Reagan was able to get, that shows the entire story of the growth of postgraduate programs, docs being trained here and staying after they have residencies. Those mixes of human beings are phenomenally different than they were 20 years ago, and reflect the community much more than they ever have. Now, I don't think anybody's going to give you a timeline as to when our country grappling with the disparities in access and these things that we all see and know, it's going to be fixed on 2029. It's always going to be an issue that has to be faced. I know that, but there's clearly a change in the way that med students and med schools run.
And I guess this is Rudy, but the thing of it is your point is exactly the problem, that we have an access problem. And the reality of it is good medicine is physicians and healthcare providers that can communicate and can have integrated systems in order to take care of people and off the appropriate level, because we can't see everybody. So there's going to be a lot more handing off to PAs and as practitioners. And the reality of it is whether it's a language, so we have a very large Hispanic population in Nevada, or it's basically whatever. It's just a very competitive market now as far as getting these healthcare providers that have these additional skills to come to Nevada. We have best case scenario as far as training physicians in Nevada, maybe a third of them are staying. Most of them leave. Almost all of them used to leave before. But the reality is we have to have the environment to make it that doctors and healthcare providers want to practice in Nevada. Being in a litigious environment is not one of those things that would basically cause that to happen. So you're absolutely right as far as what we need. The key is not suing. The key is if you got bad physicians, bad healthcare providers, then you've got the medical board that's going to be doing things according to their license and training. If in fact, with an integrated systems basically that we have, like Bard's part of, is what was Healthcare Partners, is the perfect way of providing that integrated healthcare system where you're handing patients off from the hospital to the primary care physician. And so there's not the dropping of the ball. But here again, if it takes you 2 to 3 months to get in to be able to see a physician, that's a problem. Okay, and that's an access problem. And so, but the thing too with fiduciary duty, which is something we're dealing with right now, is they're bypassing all the things of the statutes, saying you as a system basically are responsible for everything. So all the mistakes that are made, since you're a system, they're fault for it. So there are no protections, and there's punitive damages, which are 2-time damage, and there's interest on top of that. And that's where you're getting some really large awards, because they're bypassing the system that we have in place and penalizing the integrated systems that we're trying to provide with a limited number of providers that we have. We're doing the best that we can. And the reality is that we're going to need to be able to change that. But if you don't have an ample supply of providers, you're going to have more problems getting access. You get delayed access. You're going to have poorer outcomes. Essentially, you're going to have people that basically are not getting the quality of care, and essentially they're not happy about it. And no one really is. It's just a matter of working at it. But the legal system is not the way to do it. And that's kind of what we're trying to say.
And Danisha, if I could just add one more piece, because I think you were mentioning, making sure that patients, and if there is an incident, that those individuals are protected. And that has absolutely been a priority of ours. And that's why we ensured that on the economic damages, there is no cap. So there is no limitation on how much an individual can be awarded. That that cap of $350,000 is solely on the non-economic damages. And again, not to point fingers at any of the attorneys. I have friends and family that are attorneys, but with that said, we wanted to ensure that those awards were going to individuals. If there was an incident, they were receiving the greater portion of those awards. And that is why there was a scaling of those attorney fees.
And I think
And
it's really
again, that was to
important.
protect patients.
Yeah, and I think it's really important to note, Reagan, that in that system where attorneys are getting more of the money that, you know, that is not going to the patient, but going to them, then that is when the actual patient suffers, because they don't have the funds, right, to take care of whatever was lost, right, debilitated, whether it was their mental health, their emotional health, their physical health, whatever it was. And so what I'm hearing here, and I guess I'm just trying to summarize and make sure that I understand correctly what this, what you all's goal is, right, is that our attorneys are getting 65% of malpractice suits. Our judges are being elected and without trial experience. And so they're the ones who are obviously making the last say so on these cases. And so we all know that attorneys also present the case, right? And you're as good as your case. You're as good as your evidence. You're as good as your speaking. All of those things come into play. And we know also nepotism happens between judges and attorneys sometimes. So there's all these things in place. And at the center here are our patients. And then outside of that center, yeah, is the doctors who are being sued and saying that they hurt someone, right? I guess I'm more concerned, like Denisha said, what if a doctor does hurt someone, right? What if at any point, you know, if those things are not taken in consideration, where it's the attorney just presents a really great case and the attorney doesn't win, and now the person doesn't get anything, and they're left debilitated. Are we still protecting those people with the policies that we want to bring forward?
I guess the point is this really is that if there really was harm, they settle. I mean, these cases basically where it's basically the individual has been harmed,
Gotcha.
then and they settle. I mean, no one takes a case to trial when they realize they've done something wrong, and the risks, especially with the judges, they just settle. And and then here again, I think the key is, one, you've got to make that person whole, which is part of. But the key too is, bottom line is, if you have a physician that's impaired, that is not following appropriate protocols or practicing impaired, then the medical board's responsibility is to address that physician and either remove their license or create a system basically for to re-educate them. And that's the system that we have in place to do that. But for the most part, really, if there's been really harm, then they settle those cases and very quickly.
That's good to know.
You know,
Yeah, I see
when
a holistic problem here. I see, that's just how my brain thinks. I see all of these things happening. I see attorneys, you know, getting too much. I see a system, exactly. I see the judges being an issue. I see, you know, people bringing frivolous lawsuits. I see all of these things, and it's, you know, we can only concentrate on, you all are concentrating on the thing that you can concentrate on, and everyone else has to concentrate on what they can, obviously. I guess my question is, how do we fix the whole system when it comes to this?
Yeah, you know, my spirit, there was a saying about my sphere of concern is really big, but my sphere of influence is about this much of that. Yes. How much can I fix the Ukrainian, the Russian invasion? I can't, but I'm really worried about it. So it's the whole healthcare system and the pieces that my, 50 years in it after training in several states and watching healthcare delivered, it's not an organized, terribly effective system. We have pockets of excellence, pockets of phenomenal coordinated quality, and a lot of rodeos going on where it's just hard to do that. And the one case that I was part of, a team of people taking care of a patient in the ICU in California, there was a settlement, and nobody felt good about it, but because of the complication that occurred with a very sick patient that a bunch of us were working on. But there was enough damage that we didn't want to fight it. You settle it. Smaller things, and I think, Elisa, like you're describing, from individual patients who look up at this monster system. I use the system loosely. How do I get help for myself when I've been wronged? And while a hospital or a large medical group like Intermountain Healthcare, where I worked, for years, there are organized systems where if you need to knock on the door or lodge a complaint or deal with something, they're very formalized. You can just, where sort of to go, and you can find that avenue usually easily. Sometimes it's a little work, and get an answer and get help, get something rectified, and get your voice heard, and whether or not there's been enough damage to do something legally. But much of the healthcare is not delivered in that organized of a setting like Dr. Matthews is describing, and there's just too much going on in this whole sphere to tackle it all. This team could take it on. We'll put out an ultimatum, a white paper, and the state of Nevada will adopt it. It may take a lifetime, but it'll never happen.
Right.
Too much interest. It gets slayed when you try to do much of these things.
Yeah, and I thank you for that, Dr. Coates. And for those of you who are attending, I do see your questions in the Q&A. We're about to get to them. And for those of you who are watching via Facebook, please put your questions. And Kawana, please be checking the Facebook in case there are any questions. Dr. Coates, you have been practicing for over 35 years per your bio, and at least 15 years here in Nevada since 1998. So I have a question for you, and I can tell you're very passionate, and so maybe that might answer it. But, what has kept you here in Nevada practicing, and maybe some of your peers and colleagues that you know of? And then I will embed in a question from our participant, Gregory Drake. Thank you for joining. He asked, what incentives or why are there no incentives to keep doctors in Nevada the way they do with big corporations? And of course, answer from what you can. So kind of two questions there.
Right. So the larger groups like Intermountain and SMA, and UMC, employs physicians and nurse practitioners and PAs in every discipline you can imagine. Attracting physicians into the state or hiring them from training programs for the big systems is easier than it is from somebody in private practice. Specialists who make are a much different income level in primary care. But attracting someone to come in and pay their own malpractice insurance and deal with the world as it is without automatic referrals into smaller settings is a bear. Larger systems, as I mentioned, have more ability. Intermountain pays for the liability coverage, or it's self-insured, big enough that one can do that and deal with that in a very different way from independent practitioners. The attractiveness to Nevada, when I interviewed docs to come in to work in our medical group over a course of years, liability came up, education systems came up, cost of living, access to culture, the usual things that we in Nevada, and in my 20 years, is drastically better being here from coming in 1998. There's much more, there's professional sports, public education, still, I don't think, a strong suit of ours here in the community. And healthcare access is always a problem. It always has been a problem. So there's a whole list of things that go into attracting, hiring, and retaining physicians in Nevada.
So you would say that you all's interest in kind of blocking this policy that the trial attorneys are pushing is to attract more independent practitioners?
It's improve the whole health system in Nevada, and this issue we have here isn't just for solo practitioners and private practice. It affects a whole system. Working in a hospital as a hospitalist, working in a hospital as a specialist. Those things affect everybody. Doesn't matter where they live or exactly who they work for. The hospital awards get out of control, like Rudy's just mentioned, and we're going to have the same problem. So it's up and down the entire list of healthcare professionals. This thing helps for nurse practitioners, for PAs, for behavioral healthcare workers, obviously psychiatrists, everyone, to keep this from going out of control again and ending up at a tipping point. If the trial attorneys, as they've said privately and publicly, they're going to try to get rid of this legislation, get the statute removed or adjust it to the point that it will virtually neuter it and go right back to where we were 20 years ago, which would be disastrous.
So I have a just a I guess not a question per se. Well, yes, a question, but also just kind of listening to what is being said. Medical bleeds over into public health. And I think that's what, if some of my public health colleagues are on, and they're probably wondering why, why did she invite me to this? I think it's really important for us to understand that as we work in public health, right? Yes, we are not medical practitioners and things of that nature, and we are non-clinical most of the time. But it does bleed into our healthcare system, because when we see people from the community level and we send them to a doctor, we do send them with our care and our concern that they get the right care, right? And they have access. As I spoke about HIV before, sending people to an HIV infectious disease doctor is very difficult here. And if you can't get in, it's maybe 2 to 3 months before you see someone. In that time, someone's numbers can change, someone's white blood count can change, right? And so we look at all of those things. And I think all of this is just really important for the public to understand that all of these systems bleed into each other. As we get our public health reports every year, since I've been in public health for the last 10 years, we've had a D on our report card. And we just look at that and we say, wow, public health is not doing well. But I also think we need to look at public health bleeds into medical. And so that means our medical system is not doing well either. And so I just wanted to point that out, because a lot of people that may not even be in any of these fields may, just say, well, what's the point? What do I need to do? Or if this doesn't, this doesn't matter to me. I think it really does matter if you're a person living in Nevada, and either way, on either side. Of course, if you're the patient, you should care. And then if you are a public health person or a medical professional, you should care about these subjects and what trial attorneys are putting out there. So I guess my question is, what do we need to look out for in this? Is it in the ballot? Is it something that we vote on? What do we need to look out for, Dr. Mathis and Dr. Coates?
So Reagan, you want to start the conversation on this? A good one.
Yeah, thank you. Happy to jump in. One, I would say, please go out and vote, make informed decisions, and research your candidates and vote. But as far as the discussion around the attempts from the trial attorneys, we have spoken with legislators who have told us that there is going to be legislation in the 2023 legislative session that will either remove those caps or again, raise them to an amount that makes it very challenging or too costly for physicians and facilities to be able to maintain their medical malpractice insurance. And so then that's when we have that trickle down effect of us not being able to have access, because they're going to either move on to other places or our educators and our individuals that are going to school are not going to stay here. They're going to go elsewhere to provide care elsewhere, where it's a much more economically feasible place for them to provide that care. So our ask is if this is something that is important to you and you can see the need for it, please communicate with us. Reach out to us you can go to yournevadadoctors.com, our website, and we are looking for individuals such as yourselves to join our coalition, so that when this legislation does come up, share with your legislators your voice. They do listen. So engage with them, share with them the impact that this will have on the communities that you represent and that you live with. Testify before the committees. We welcome any and all engagement from you and would love to partner with you moving forward.
Thank you for that.
The approach we're putting together with R&R's partners as our leadership, we'll have material things to do after the general election, the run up, and then including the legislature. Reagan, how many total senators and assembly people do we have in Nevada that are in the legislature? What's that total number?
Yes, so there are 63 total. So you have 21 state senators and 42 assembly members.
So those 63 people somehow we will have communicated with thoroughly. We will work through every channel we can. We'll need grassroots where people write letters or send emails in support of we don't know quite how things are going to maneuver yet, but darn sure know that it's going to be a big deal. And we have strategies in our pockets we're considering. So when you hear more about it, or if Reagan's back in touch with you, we'd love to have your name of your organization in our information to show the community partnerships we have, including the ones Reagan mentioned earlier. And then we have a couple of grassroots groups that will be communicating with their legislators specifically early in the session, depending on what comes out that we'll have to fight against. So that's the way we look at it. Sure, we'd love to have you donate money to us so we can pay for our efforts. But that's not the point of the conversation today. It's to engage you and get you to understand it, and hopefully to join the coalition of our community partners that we can use the name. And then when it's time, and January the 29th, that we need letters or emails sent to state senators or assembly members to support our position, that would be a big deal. That sometimes that's more helpful than lobbying in that regard.
So you all, the website is yournevadadoctors.com. That has been listed in the chat for you all to get involved with this cause, get more understanding and know what's going on. So I imagine this is more preventative, as we know some things will be coming down the pipes. Be mindful of who you're voting for and what they stand behind and how that will protect you and your rights as consumers. And really our healthcare, the healthcare impacts everything else. It impacts education and all these other areas that we deal with in Nevada, and we find ourselves constantly at the bottom. So we want to ensure that we are getting involved to ensure that we have access to healthcare. As a mental health professional, I know how important having that physical health is to maintaining mental health and being able to rule out some things. And so this is really important. We do have to come to a close, but Reagan, if you or one of the doctors just really briefly want to share, since the medical malpractice cost has answered this question, because I think it's important for people to know, has the medical malpractice cost been stable since you all passed that legislation? I think was it 2002 or 2004?
This is Dr. May. The answer to that is, it's been asked before, is yes. The reality of it is the number of med mal companies that have come back to Nevada to provide competitive rates for physicians has increased, and the overall cost of physicians has stabilized. And so it's done what we said it would do.
So that's good to know, because obviously y'all know I came in here playing devil's advocate because we have to have a fair conversation, but I want people to understand that, hey, doing this is not going to hurt the protection, the stability of our doctors, as well as our patients and consumers being able to access healthcare. We want to thank you all for joining us today at the Urban Chamber Healthcare Roundtable. Such a delightful and needed discussion, y'all. We have to get involved. I know oftentimes as business owners, we're not thinking about these things, but they're impacting our employees, they're impacting our family members, and they thus impact our community and our economy. So we have to be engaged in these types of topics. I heard somebody mention donations, so I would be remiss if I don't mention Solutions of Change, my nonprofit that provides free therapy and counseling, is doing a healing holidays in December, where we are giving our families that we service an opportunity to have a therapeutic holiday experience, as well as have some gifts and things that they might not otherwise access. So if you'd like to be a part of supporting that, we can get you a tax exempt letter. We're doing journals, hygiene kits, therapeutic things, but also we want to give them some toys. You can go to solutionsofchange.org to find out more about it, or reach out to me and donate via cash tag, Solutions of Change, or just reach out and we'll let you know if you want to be involved too, so that you know that your funds are going to support these families. Any final words before we close? Go ahead, Elisa.
Yes. While we're dropping plugs, you can also donate to the Minority Health Consultant Scholarship at School of Public Health at UNLV. I started a scholarship fund in a couple months ago for students of color, people of color, to be able to go to public health, School of Public Health, go through school if they need books, if they need to take a class and they're going to be kicked out. So this scholarship is available on minorityhealthconsultants.com if you would like to donate to that scholarship fund, so that people of color can be in this field and represented a lot more, so that we can help that diverse community of Las Vegas and Nevada, because Reno is becoming very diverse as real. And so I just wanted to drop that in there as well. But thank you all for joining us. Thank you for being here, asking the great questions that you did. Gregory Drake, I hope that you come back and ask some great questions again every month. That was a great question that you asked. And anyone else, please just join us every month for these conversations, so that you understand how business and healthcare impact each other, and you can do better for your community.
And reach out to us if you want to get involved with the Healthcare Roundtable. We will be changing how it looks in 2023. And so we want your involvement so we continue to grow this and have these wonderful conversations with these amazing people. And any final words? I know we're a couple minutes past, Reagan, but this is recorded so people can look at it later. Any final words for the listeners?
Thank you so much for the opportunity to share this information with you. It is a topic that is of great concern, and I think we've articulated that. And so if anyone is, after watching this or engaging with this, wants to get involved, please reach out to Danisha or Lisa, and do not hesitate to give them my contact info directly. If you have more questions, please don't hesitate to contact. Happy to have more discussions, and just thank you for your time.
And Reagan,
Thank you.
stay on after, please.
Yes.
Thank you all.
We're going to stop the recording, y'all.